This is Viewpoint.
Welcome to Viewpoint. I'm Doug Petcash. It's that time of year again. No, I'm not talking about raking leaves or getting ready for the holidays. It's health insurance open enrollment season. Many of you watching have probably done it already or are doing it now. But if you don't have health insurance through your employer and you don't qualify for Medicaid or Medicare, there is another option. You can now enroll for medical and dental coverage through Your Health Idaho. That's the state health insurance exchange. But time is of the essence. The Your Health Idaho open enrollment period ends December 15th. This year, the exchange is offering 141 medical plans and 21 dental plans. And for the first time ever, you can apply for a tax credit and health insurance on the same application and find out if you qualify within minutes. Your Health Idaho says enhanced tax credits, which are only available with plans bought through Your Health Idaho, significantly lower monthly premium payments. On its website, Your Health Idaho gives these examples. A married couple in their 60s from Ada County making $60,000 could get covered with a mid-level plan for about $300 per month. A family of 4 in Bannock County with an annual income of $85,000 could get covered with a base plan for $0 per month. And a single person in Twin Falls County can get an entry-level plan for just $4 per month. Today, we're focusing on what the exchange has to offer and how it can save people money on insurance premiums. My guest is Your Health Idaho Executive Director, Pat Kelly. So, Pat, I'd like to welcome you here to Viewpoint. Thanks for your time today.
Yeah, good morning.
Well, before we get to the nuts and bolts of what's being offered this year, let's talk a little bit about the history of it. So, why does Your Health Idaho exist and how long has it been around?
So Your Health Idaho was formed in 2013, and Governor Otter and the legislature had the vision that Idaho knows Idahoans best, and Your Health Idaho is an Idaho-based solution. We offer health insurance year-round, but of course open enrollment is the time for everyone to find a plan that works best for them. This is our 10th open enrollment, and we're still making things better every single year.
And we'll get into some of that too, but is it a government entity?
So we are a government entity, but we're not a state agency. So what that means really is we have to make enough money to pay our bills, no more, no less. And we're really focused on solutions that work for Idahoans. So we don't have outside vendors, we don't have call centers in other states. Everything here is focused on Idahoans. Our call center is right here in Boise, and we're here to serve people.
Who oversees it?
So we have a board of 19 individuals. They're all appointed by the governor, and they're from all walks of life. So everything from insurance carriers to agents to small business owners, former healthcare workers, as well as people focused on consumer interests. So a 19-member board provides a lot of diversity of opinion, and it makes sure that we find solutions that work for everybody.
All right, so let's talk about the exchange. If someone's thinking about getting insurance through it, how does the exchange work?
So with Your Health Idaho, you have a couple of options. So let's just say you want to find out what you might qualify for. So you can do anonymous shopping. You can go in, enter your zip code, a little bit about your income.
And that's to yourhealthidaho.org.
Yes,
right?
yourhealthidaho.org, thank you. And you can find out, what you might qualify for. And then when you're ready, there is an application. And that application will take typical information, where you live, what does your family composition look like, and from that, we determine your tax credit, and then from there, you shop for plans. And you might filter those plans based on your provider, who you see, who your doctors are, or maybe you have a prescription that you take. And all of those tools then help zero in on a health insurance plan that meets your needs. That's shopped right on our website, and then you're enrolled with one of the carriers that we have that we work with.
And this year, one of the things that's different is people can do that all like in one-stop shopping, right? And do
That's
the whole
right.
process at once.
Absolutely. So this summer we deployed new technology, and we call it real-time eligibility. And what that means is once you've filled out the application, you hit submit, the little wheel spins, and in about a minute you get the answer for your tax credit. And then you click on shop for plans and you go through, you browse, you look at what the different options are, and then you select a plan and you're enrolled.
Let's talk about the plans too. I mentioned that it was 141 medical plans this year, 21 dental plans. When someone goes in, can they shop from all of those 141 plans, or is it divided out across the state somehow?
Great question. So It depends on where you live. So we have 8 medical carriers, and some are in all parts of the state, others are not. So it does depend on where you live, but in all counties, there are at least 4, and in most, there are about 6.
Okay. And it can be daunting. You know, people think, oh my goodness, I've got to go through all this information, but there's help through the site, right?
There are. So we have support center folks that are trained on how to go through the process. But when it comes to really selecting that plan that's best for you, we have a network of certified agents and brokers. So they're licensed by the state, and then they're certified by Your Health Idaho. And what that means is they understand the process, they understand the application, and they can walk you through that process. And then when it comes to selecting a plan, they may want to know, what are your needs medically? Do you have a chronic condition? Are you looking for more of wellness coverage? Those conversations then help form what plan is best for you, including, of course, your budgetary requirements and that sort of thing.
And that being said, is it a tiered system? Like you can, different levels of what the premium would be?
That's right. So we have 3 what we call metal tiers. So bronze, silver, and gold. And the easiest way to think about it is the less valuable metal is less expensive to have, but more expensive to use. That would be bronze. And then when you go to gold on the other side, it's more expensive to have, so you pay more in a monthly premium, but your copays and deductibles are lower.
But there are tax credits. You've mentioned that a couple times. How does that work for people applying?
So a tax credit is based on your income, how many people are in your household, and where you live. And that tax credit then is applied to the cost of your premium. So a little over 9 in 10 of our enrollees receive a tax credit. On average, they save about 80% on their premium. So it can really be significant. In fact, 1 in 3 pays $0 a month for their health insurance.
33% of
Yes.
applicants. Wow.
Yeah.
Okay. Also, this year there's something also a little different with the tax credits that could make it even more affordable. Can you explain that change this year as it applies to people who are working and their families?
Right. Yeah, so about 700,000 Idahoans get health insurance benefits from their employer. And generally speaking, the employee has a lower premium that they contribute to than their family members. And what's different this year is the affordability calculation. And what that means is deeming that premium affordable. In the past, affordability was based on the employee premium, and if it was affordable, the family could not get a tax credit. But the good news is, in 2023, that affordability is calculated separately, one for the employee and one for the family. So if all these numbers and affordability aren't quite making sense, let's talk about a family of 4, gross income of about $60,000. So the employee pays $75 a month. That would be considered affordable. But when you combine the family, it's $475. That is considered not affordable. The family members would then be eligible for a tax credit, and they would shop on the exchange.
And so it could switch the whole family, including the employee, over to the health insurance exchange, or it can now be separated too, where the employee can stay with their employer insurance and the family could get covered through Your Health Idaho?
That's right. It is all about the affordability for either the employee and or the family. So you could have families that are split, but you could also have families that all shop on the exchange. And if all that math is kind of overwhelming, and it can be, our application process takes care of all of that for you. So you would enter your premiums, what you pay, your income, and it would calculate the affordability for you.
Is there always a rush in the last couple of weeks? Because this open enrollment period is 2 months long.
Yes.
But is it a big push at the end?
Well, we see demand spike immediately in the beginning, and then it really spikes after Thanksgiving. So the deadline for health insurance is December 15th, but we see a big surge after Thanksgiving. People realize, December 15th is going to be here pretty quick. Really encourage people not to wait.
How many people in Idaho get insurance through Your Health Idaho?
So we have about 80,000 Idahoans that are currently enrolled in plans through Your Health Idaho. The demand has been higher than ever, and we are very excited about One, how we're able to work through those applications with real-time eligibility. It's quicker than ever before, and it's also easier than ever before.
And how many do you expect in that last 2-week or 1-week period?
We see anywhere between 8,000 and 12,000 enrollments in the last week.
So the wheels are really going to start rolling coming
Yes.
up. All right, Pat, we're going to take a quick break, but up next, what's keeping Your Health Idaho healthy? Stay tuned. Welcome back to Viewpoint. Idahoans who don't have health insurance through their employer and who don't qualify for Medicaid or Medicare, there is another option. You can buy a plan through the state health insurance exchange called Your Health Idaho. In the previous segment, my guest, Your Health Idaho Executive Director Pat Kelly, explained what the exchange has to offer and how it can save people money on insurance premiums. But now I'd like to talk a little bit about the health of Your Health Idaho. So, Pat, what makes this exchange economically viable?
So Your Health Idaho, when established by Governor Otter and the legislature, required us to be self-sustaining. And that means we have to make enough money to pay our bills, hopefully not more and certainly no less. And what we did from the very beginning is really ensure that not only did we understand the costs that we were going to incur to get the exchange up and running, but what would it be 5-7 years out? So we've always had a long-term view of our financial sustainability, and we've made decisions today knowing what that impact is in the future.
So how is it funded then, I guess? Is it through the premiums that people do have to pay?
So we earn 2.29% on every premium sold through the exchange. So for a $500 premium, it's $11 per member per month. So it may not sound like much, but it does add up. And it does allow us to pay our bills, invest in our technology, invest in our people, and make sure we're able to deliver for the citizens of Idaho.
So are you anticipating that this will be around for a long time?
Absolutely. When we run our financial models, we're running out to 2029, and I think the only reason we don't go further is simply because it gets too hard to predict beyond that. So we're here for the long term. We plan for events for impacts from economic changes to job changes, population changes, and we have a healthy cash reserve so that we can weather those changes.
You mentioned population changes, and that was what I was thinking about was, we've seen so much growth, particularly in the Treasure Valley area. Have the number of people applying kind of correlated with that at all?
Well, they have and they haven't. We know a lot of people that moved into the Treasure Valley kept their employer-sponsored coverage with maybe that out-of-state employer that they still have. So we didn't see a lot of growth from that. But what we did see growth in was in our age 55 to 64 enrollees. And we think that is people entering retirement early, and they're not quite eligible for Medicare yet. So they're able to join the exchange for a few years to kind of fill that gap between retirement and when they're eligible for Medicare.
Is it like any other, employee or employer offered insurance where open enrollment is now, but if you have a life event that you could join a plan through Your Health Idaho at any time of the year?
That's right, Doug. So open enrollment is going on now through December 15th. It's the one time that anyone can enroll if they're not eligible for Medicaid, Medicare, or affordable employer-sponsored coverage. Outside of that, you need to have a major life event. So we call them qualifying life events, something like getting married, moving, having a baby, those sorts of things.
Okay. So how do you recruit and retain the insurance carriers?
So we work closely with the Idaho Department of Insurance, and they work with the carriers for what we call plan management. Do they meet all the requirements, those 10 essential health benefits that are with every single plan sold on Your Health Idaho? They work on those relationships, and then we're focused on operations. So how do we interact with the carriers to make sure that Idahoans that enroll with us have a seamless experience when it comes to getting things like your ID cards and making sure your coverage dates match and all of those details.
Are the carriers familiar names that people would trust?
Absolutely. We have 8. So everything from Blue Cross of Idaho, Select Health, Pacific Source, Mountain Health Co-op, Molina, Moda, and also St. Luke's Health Plans and Regents. I believe those are the 8 medical carriers.
You listed them right off. Yeah, absolutely.
And so they are household names, and we have 2 new carriers this year, which is always great to see different options for consumers. So St. Luke's Health Plans and Moda Health are the new medical carriers this year. And then we have a new dental carrier, Guardian Life.
Mm-hmm. And at this point, Your Health Idaho doesn't offer vision care.
Actually, we do.
You do?
We have Vision Care. It is VSP is the carrier, and that is offered through our website as well. It's a slightly different shopping experience, and tax credits don't apply, but we do offer vision.
Oh, okay, so there is that option.
Yes.
Well, Pat, let's recap here as far as how can people research and choose a plan for them? Where do they have to go, and how easy is it to navigate?
Great place to start is our website, yourhealthidaho.org. We have a number of frequently asked questions. We have our support center. You can call and get applications or questions on the process, live chat function. And then, of course, most important, we have over 900 agents and brokers all across the state. They're no cost to you to use, and they are experts with health insurance.
And so you can do your research both anonymously online and then also free,
yes,
getting the advice to see if it's the right choice for somebody.
That's right. So on our website, yourhealthidaho.org, click on Find Help, enter your zip code, and a list of agents will show in your area.
All right. Pat Kelly with Your Health Idaho. Lots of good information today, Pat. Thank you very much.
Thank you, Doug.
All right. Well, still to come on Viewpoint, the future of nuclear power in Idaho. We'll take you inside the Idaho National Laboratory. Nuclear energy has been a staple in Idaho for decades, and that legacy continues today. New developments in nuclear could soon be making the energy more sustainable and accessible for Idahoans, and really the rest of the country too. Nearly 20% of the nation's electricity is generated by nuclear power. As that demand increases, the Idaho National Laboratory is working on new developments that will power nuclear energy into the future. News Channel 7's Jude Binkley went out to the eastern Idaho desert, where he got a rare look inside the INL.
People are recognizing the potential for nuclear energy as a clean baseload source of power.
The Idaho National Laboratory was established in the southeast Idaho desert in 1949. 2 years later, the town of Arco became the first city in the world to be powered by nuclear energy, a power source in its infancy back then. Today, nuclear energy has evolved into a source that produces 50% of the country's carbon-free electricity.
We're at a point in our evolution as a country and as humankind of realizing that we're incredibly power intensive, and this is only increasing the need.
This is EBR-1. It was the first nuclear reactor in the world to make usable energy in 1951, powering the legacy for nuclear energy in Idaho. But what about the future of nuclear energy?
So we're standing at the Materials and Fuels Complex at Idaho National Laboratory. This is the dome, which stands for Demonstration of Microreactor Experiments.
Over the last 70 years, nuclear energy has gone from factory-sized power plants to things that could soon be made in factories. PCAT is a prototype for the Marvel microreactor, a small nuclear reactor that can be shipped to different locations with enough power to energize a small city.
Can power a few thousand homes, to get an idea, and most of the time they can produce both heat and electricity.
If I could use the term agile, and I've used the term agile to describe nuclear.
In the beginning, nuclear plants had teams of people working around the clock to produce power. Now, new microreactors, about the size of a semi-truck, can be placed in remote locations. They're self-regulated, so they don't require many people to operate.
So very small amount of fuel, smaller reactors, smaller facilities that you can actually have, spread around in various communities. So the benefit of microreactors then becomes, now instead of a centralized power generation, now you can have smaller microgrids serving different communities in a decentralized way. And obviously, that gives a higher resilience to the overall grid infrastructure.
Arafat says that higher resilience will help disaster-stricken areas avoid wide-scale power outages. The reactors can also help rural communities where energy costs are high.
So the idea is we can actually transport a system like this once and be able to power it for multiple years before refueling is needed.
A microreactor prototype is being tested to model how the final product will work before INL finishes construction of the Marvel microreactor next year.
We're trying to get to net zero of this campus by 2031. And we already have energy source from solar, some wind. So we want to be able to bring all the clean energy technologies together, including nuclear.
Just east of the main INL site, the Energy Systems Laboratory is researching those different types of energy production and distribution.
Well, really, it all comes down to one benefit, and that's carbon emission reduction. So, allowing a nuclear power plant to stay cost effective is sort of a side benefit, but really reducing our carbon footprint from industrial and commercial processes.
And if we can get to that point, then a lot of the campuses around the United States, whether it be universities, hospitals, small communities, they can actually follow that blueprint to convert their sites to net zero as well. So that's our long-term goal. And I believe Marvel plays an essential role in that overall process.
However, not everyone is happy about the new developments in nuclear. One concern is about what happens with the waste.
It's radioactive waste, so it's probably the most dangerous waste that we can create. We can't treat it. We can't make it less radioactive. All we can do is let it become less radioactive with time. It's dangerous to have around people. It's dangerous as we're creating it over our aquifer.
The Snake River Alliance calls themselves Idaho's nuclear watchdog. They're opposed to new nuclear waste. Microreactors would produce a similar type of waste as large nuclear reactors.
It's very dangerous, it's very dirty, and it's not getting any cheaper.
However, the Alliance says INL has made advancements in cleaning up nuclear waste from decades ago when scientists didn't fully understand how to handle it. Nuclear waste is stored in casks underground where it decays over time. INL says advanced reactor technologies can also reuse or recycle some waste, but waste still needs to be stored somewhere.
Presumably, it will leave the state and go to this repository that doesn't yet exist. So there seem to be a lot of balls in the air. It will be here indefinitely, and I fear that means forever. It's not really fair to put it on other people, really, when we're creating it here.
We contain it, we secure it, we store it, we monitor them, and make sure that nothing comes out into the environment or affects people.
While nuclear waste continues to be a concern, the demand for an improved energy source is higher than ever. INL hopes to shed light on the future of nuclear energy like it did 70 years ago when the lights went on in Arco.
That was our Jude Binkley with that special report. The INL plans to power up the Marvel microreactor in 2024. Looking further into the future, the INL will be developing more projects to advance nuclear energy, including another microreactor, test beds, and a versatile test reactor. If you'd like to take a deeper look into how microreactors run and how renewable energies can work together, we have a story on our website right now, ktvb.com. That's all of our time for this week's Viewpoint. Thank you so much for watching. I'm Doug Petcash. I'll see you later today on the Sunday News at 4:30 and 10 p.m. and right back here next Sunday morning for another Viewpoint. Have a great day.